it is imperative to protecting life that we continue and to probably enhance our social distancing efforts and encourage more actions by our businesses and citizens to minimize social interaction. I am not at this meeting today because of a gathering of more than 10 people. And both our President and Governor have said we should avoid such meetings. I feel it is important as your public health officer to set the example to our community and attend this meeting via video conference. I appreciate the opportunity to do so. I also want to point out there is a public health advisory in place that was issued this past week that advises all persons over 65 years of age or anyone of any age who has a serious medical condition. And let me just list some of those. Chronic lung disease, moderate to severe asthma, serious heart condition, immunocompromised status, cancer, severe obesity, diabetes, renal failure, and liver, to stay at home and only go out to seek medical care, prescriptions, and groceries, those essential services to keep your life going. It is a risk for those of you who fit any of those categories to be at this meeting today. All right, so let's talk about since the last time we spoke. Since the last time we spoke, I can report to you that we have progressed to community spread throughout Florida, throughout the entire state. In the U.S., as of last night, there are over 140, almost over 141,000 cases, probably more at this point. All states, D.C., Puerto Rico, Guam, Northern Marianas, and the U.S. Virgin Islands are reporting cases. We have more cases than even China. As of last night, there were 5,704 cases in Florida. When I last spoke to you, I reported 328. And as mentioned also last time, we had 8 cases in our region. We now have 169 as of last night. When I was before you on March 19th, we had 5 cases. Last night, we had 36 cases. Only 3 of those were in people who were visitors. Of the 33 residents with COVID-19, 48% acquired the infection while they were in Okaloosa County. 48%. Nearly half of those diagnosed either were a contact to someone or we don't know how they acquired it based on extensive questioning. And we do very thorough investigations. The highest concentration of our cases is in Destin. This was not unexpected to me given the high amount of travel and interactions that were going on during a time when the virus was probably being passed person to person. But we see a fair number of cases in Niceville, and we have cases in Fort Walton Beach, Rescue, Mary Esther, and Shalimar. So let me tell you a little bit about the people who are Florida residents that have this infection. So males are slightly more common than females. 53% of cases are male, 44% are female. 79% of cases in Florida residents are in the ages of 25 to 74 years. 85% of the hospitalizations are occurring to people 45 years and older. 88% of the deaths are occurring to people who are 65 years and older.